How do you choose a Medicare Part D prescription drug plan for 2026? This is going to be a long form video, so if you don't have time to watch it, save it. I'm going to walk you through how to navigate it and how to choose a plan. I recognize that the slides behind me are small. I also do have a PDF of them that I'm happy to send you. If you send me a DM, a private message with your email, I will forward it on to you. A lot of you may find this year with the Medicare AEP coming up, which is October 15th to December 7th, that you do not have an agent that's going to enroll you into a plan, and you may find that you're on your own with this. So here is a step-by-step in how you should navigate through Medicare.gov to do your enrollment. You're going to start this process by going to Medicare.gov. That is the Medicare official website. And you can see at the top where I put an arrow, there's a button that you can click on to log in. Now, some of you who have a login already, you're gonna use this side of the screen when you click on that, and that's already gonna have your password, your email, and you're gonna be able to go into the system as you with your data that will show up. For those of you that have never created a login on Medicare.gov, I would suggest you all do it. You click on this side of the screen and then you follow the prompts. You need your Medicare number to do it, and you'll create a profile. Once you have created the login or you already have one, you're going to see a screen that looks like this, and it's going to say, welcome so-and-so, whatever your name is. This is my dad, so I blocked it out. But the bottom line is that you'll see your name, and then you're going to click on this, which says open all options. Next screen that's going to pop up is the ability to update your drugs and list some pharmacies. Now you may think, well, I've never added medications, but your medications, if you're filling your prescriptions through your Part D plan or your Medicare Advantage plan, are going to appear in this system. So you're going to want to click on this, update your medications. You're going to want to go through each drug listed, and you have the options you can see up top to add a drug. You can edit your drug, you can remove the drug, you can change what the dosage is if that's changed. But you want to make sure you go in drug by drug, medication by medication, and make sure your list is accurate. Once you've gone through each drug, you're going to see a button you can click on that says done adding drugs or medications. You're going to hit that, and it's going to bring you back to here. And then the next thing you're going to want to do is you're going to scroll down until you see a section called plans and coverage, and then you're going to click on find health and drug plans. So hit that button. So the next thing that's going to show on your screen is your current plan. So whatever you're listed in for 2025 is going to show up first. And then you're going to click on this find plans. So it's find plans now. You click on that button. Now I know I keep calling it a button. I don't know the technical term, but move your mouse and click on it, and that's what I mean by button. It's not an actual button. But anyways, so once you did that, this is what shows up. And it's going to say find plans now. You're going to choose the year that you're doing it for. This would be for 2026. You're going to put in your zip code, and then you're going to hit continue. Once you hit continue, this screen is going to appear, and they're asking you basically what type of plan do you want. What I'm talking about in this video is for Part D, so you're going to click on Part D, and then you're going to click on this green that says find plans. Now you're going to be presented with results, and first your existing plan is what's going to be listed, and you're going to see what the cost is expected to be for the next year. Then you're going to scroll down a little bit, and you're going to see the next plan listed. And the first plan we saw was going to be $500 and some change for the year. This plan is going to be listed as $48. Now, one thing I want you to make sure you notice, when you have these plans displayed, you're going to want to click up what you see up there, and what it says is sort plans by, and you're going to want to choose lowest drug plus premium cost, because that's going to give you the cost for the entire year. Don't just focus on the premium or just the deductible. Look at the big picture. And we can already see that in this example, the plan the person is in is going to cost like $500 more for the year than another plan if they remained in their current plan. The plans, by the way, once you keep scrolling down, are going to get more and more expensive. So typically, after they show your plan, the most cost-effective plan is going to be listed next. And you can also see what it is. If you have it on the proper setting of premium cost plus drug costs, And then you look at that number there where it says retail pharmacy, estimated drug and premium cost. That's going to give you the amount for the year, so that's how you know. Then what you're going to do is you're going to click on this and you can look at the plan details. It's going to break it down for you, what it's going to cost monthly, what tier the drugs fall on, etc. You also then can directly enroll in the plan right from the website. I can't point to it, but if you see the arrow all the way to the left, I'm filming this before October 15th, which means you cannot yet submit an application during the Medicare AP, but as of October 15th, where that red arrow is, you're going to see something like click on enroll in plan, and then you're going to follow the prompts from there, because from there, you'll be able to actually enroll in the plan that you've chosen right there through Medicare.gov. And then above me, a couple important reminders. You have from October 15th to December 7th to make changes for 2026. If you do nothing, you'll remain in the plan that you're in as long as it's a plan that is continuing. When you do enroll, if in fact you're going to change plans, by enrolling in a new plan, that's how you're going to become disenrolled from the current plan that you are in. So I recognize it's small what's behind me. There's a lot of information to take in, but just remember, you're going in, you're creating your profile, you're updating your medications, making sure it's in there accurately. The software is going to do the work for you. It's going to list your plan. You're going to see the total cost between premium and drug costs for the year, and then you can compare that to the costs in other plans. And then you can decide to switch the plan or you can stay as is. But it's really important that you start to master using Medicare.gov so that you can be your own best self-advocate. Remember, if you want a copy of these slides, all you have to do is direct message me with your email, and I am happy to forward it on to you. And then what you can do is you can use it side by side, print it out. And when you go on to Medicare.gov, just follow the steps, because the instructions will actually be there along with the images that you saw on my slide.